Welcome back to Medical Associates Health Check. My name is Dr. Laisha Selvaraja. I am the clinical administrator as well as the head of accident and emergency. So this year we're doing things a little differently. I know you're used to us having a conversation with the doctors on board, but this year we want to talk to our patients too. So coming up, we'll be discussing one of our cherished patients in breast cancer in the oncology unit, and we'll be talking to Dr. Liron Olivier today.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. And right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
So, Liron, thank you for coming back on our show. How are you doing?
I'm awesome. Thank you for having me again.
So we're going to discuss this patient that you saw, a 41-year-old female with a lump on the right side of her breast. Is that right?
Yes.
So tell us a bit more. Just give us a little quick recap.
So again, it was a very suspicious right breast lump. I mean, it had suspicious features of it being firm, hard, irregular. There was some attachment and some tethering and pulling of the skin.
Yeah.
And she unfortunately also had a bit of a swelling in the right armpit.
Okay. And so when you took the history, you had found out that she didn't really have any massive risk factors except that her mom had ovarian cancer, right?
Yes. So that definitely may be a link.
Right.
Some sort of familial or genetic link between the risk of having breast cancer and ovarian cancer.
Right. And I think a lot of people aren't aware of that.
Definitely.
They think that they're two independent factors, and it's really important to take that history, find that out, and then you could always do testing, genetic testing around it.
It's definitely going to impact her clinical treatment as well. So it's important for us to get that in the history.
Great. And so you then examined her and thought it was important for her to have a biopsy.
Yeah, it's just a continuation of the triple assessment that we perform.
Yeah.
We must get a tissue sample. So we do the history exam, and then we did our radiological investigation, and then we proceeded to a biopsy for her.
Don't go anywhere. After the break, you get to see the consultation between Shelly-Ann and Dr. Olivier and how her biopsy went forward.
At Medical Associates Oncology Unit, we know every cancer journey is unique and deeply personal. That's why our team of expert oncologists, nurses, and specialists are here to provide you with world-class care right here in Trinidad and Tobago. From early diagnosis to advanced treatment options, we offer cutting-edge technology and compassionate support every step of the way. We're here to guide you emotionally, mentally, and we understand how costly treatment can be. So, we have reduced our prices to assist you financially as well. Every aspect of your journey matters to us. With expertise you trust and care, you can feel Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
Good morning. So my name is Dr. Liron Olivier. I'm a breast surgical oncologist. Could you just remind me of your name?
Sure, it's Shelly-Ann, right?
And Shelly-Ann, how young are you?
I'm only 41 years old.
And tell me how I have the pleasure of seeing you today, my best friend.
So I was in the shower and I noticed a lump on the right side of my breast.
How long ago you noticed this lump?
Probably like a week ago. At first I thought it was nothing and I was ignoring it, but then I was like, no, it might be something, so I think I should check it out.
During that short duration of time, do you find that the lump is getting bigger in size?
I didn't really see a change, but I felt it more predominantly being there.
Okay. Is it associated with any overlying skin changes in the breast? For example, if the lump is pulling the skin or any indentation in the breast?
No, I didn't see anything looking like that. But I mean, you're the pro, so maybe you might be
we'll
able to
examine you
better.
and we'll evaluate.
Yeah.
Is there any discharge from your nipple?
No discharge.
Okay. And is there any issues with the right breast?
No, I'm not getting any pain or anything like that. It's just the lump I'm feeling there.
Have you ever had a lump like this before?
No, it's the first time I've felt something like this.
And in your youthful age, have you started breast screening as yet?
Honestly, I haven't done.
Generally, we recommend breast screening starting at age 40. So after today, this will be an opportunity for us to start breast screening.
Okay, definitely.
What age did you start seeing your monthlies for the first time?
Like 13.
Yeah. 15?
A long time ago.
Do you have kids by chance?
I have one son.
And how young were you when you had that first
I
child?
was 28.
Yeah, and did you breastfed that child?
Yes, I did.
Yeah, what duration? More than a year or less? Than
Like a year and a half.
do you have any history of any surgeries to the breast?
No, no history.
Yeah, and do you have any family history of breast cancer?
No, but there is ovarian cancer. My mom, she died from it.
Your mom, okay.
Yeah.
What age was your mom when she passed?
She was
away?
61.
Did they do any investigations, for example, any genetic screening to see if there's any abnormality in your family genes predisposed to such cancers? No. Do you take any sort of oral contraceptive pills or any sort of hormonal tablets?
No, I just take basically glucophage, which is like,
Right.
because I have polycystic ovaries, just to kind of regulate the sugar. But other than that, no, I don't have anything
So in
else.
terms of your past medical history, you have what they call PCOS,
Yes.
polycystic ovaries.
Yeah.
Do you have any high blood pressure or
No,
sugar
thank
or
God my pressure is good.
No. And you never had a heart attack or a stroke?
No,
So besides the medication you take metformin, you don't take any other medication?
no, I don't.
Do you have any bad reaction to any medication?
No, actually, I have no allergies and no bad reaction.
Okay. You ever had any surgeries?
No, never did.
Do you have any family history of any other cancers in family?
No, not to my knowledge.
Nobody have any prostate cancer, no male breast cancers, no pancreatic cancer?
Mommy was the first.
So very healthy family otherwise.
Yeah.
then. Do you smoke or drink alcohol by chance?
I drink occasionally, like every Trini.
Yeah.
But no, I don't
So do you
smoke.
get intoxicated every weekend?
No, I don't.
There's a significant smile in your face.
Well, maybe for carnival, but not all the time.
So you have plans for such.
Well, maybe.
And what about occupation? What job do you do?
Oh, I'm an accountant.
An accountant.
Yeah.
Okay. Have you ever done any sort of investigations to your breast, like a mammogram or ultrasound, anything?
Just the basic checks that you do when you go by a gynecologist.
Right.
which
So
would
that's
be-
clinical examination.
Yeah, correct.
Do you examine your breasts once every month? Like,
I try to do it, but I mean, sometimes you do forget with life, but
okay. So I just want to give you an overall summary how we plan to do stuff. So when a young lady has a lump, the first thing we do is a history, which
Okay.
you just completed, and then we will do a clinical examination.
okay.
And then following that, we send you for a mammogram and ultrasound.
Okay.
In your age group, you'll definitely do a mammogram, and then we'll do a breast ultrasound. A mammogram is like an X-ray of the breast, so it takes pictures of the breast, where we can see both fatty tissue and breast tissue, and sometimes the abnormalities look similar to the breast tissue, it looks a bit white, to
Okay.
help us to delineate any abnormalities. And then an ultrasound scan works on a different principle of sound waves, and that can help us to know if something is solid or cystic. So after we have completed the investigations, the imaging, then we proceed to a tissue diagnosis. What that means is taking a sample of the lump to see if there's any abnormal cells within it. Yeah, and that's what we call a triple assessment. Every woman who has a breast lump, ideally that should be done, so we can thoroughly evaluate this lump and see if it's something cancerous versus non-cancerous.
Non-cancerous,
Right,
okay.
so the next step is we will do the clinical examination, and then I'll send you off to get the investigations, all of which can be done today.
Oh,
you can do
today?
the mammogram and ultrasound
Wow,
today
okay.
and get an evaluation. And if it is that there is an abnormality and we do need to do a biopsy, we can proceed with that today, and we get the results back within 24 hours as well.
Wow, that's a really fast turnaround time.
Because I mean, anxiety is, as I'm sure you're going through now,
I
is
am,
significant
yeah.
anxiety waiting for a result.
Yeah.
And one of our goals is to, health is not just about physical well-being, but it's also about mental well-being. So if we can ease that anxiety, it's definitely going to make the process better.
Yeah.
I was diagnosed with colon and liver cancer. Hearing the news, I was devastated. Having to go overseas, that could be stress and away from your family. Medical associate, there was no other place to go, and I'm glad that I did, because they made my journey even better. I'm more comfortable. They made me part of the family. So besides my immediate family, I now have another family here. I was asking about the cost, and she was like, don't worry, we could organize. So that was a burden taken off of my shoulder. It was like a personalized thing. It wasn't just like the cost, because I've heard that it's so expensive to do this, but they treat you as an individual. I would like to thank Dr. Raghunandan, the office manager here, the nurse in particular who is here with me during the chemo, and Dr. Bim. And also Dr. Solomon, because he was the one that did the colonoscopy, but they made me feel comfortable. I would recommend medical associates because number one, the care that you receive. They make you feel comfortable and being part of a family besides your family. Because it's not that matter. What matters is to get you better. So I'm glad that I have this option here, and many other people will also have this option here if it is that they just do their research. For anyone who is going through this, don't lose hope, keep the faith, and know that once you have a positive mindset, you can get through this. together with the medical staff, together with your family, it can be done.
So we just completed the clinical examination. I've just discussed the findings. So on clinical examination on the right breast, I found a lump in the upper outer aspect of the breast. There is some concerning features about it. One, it's about 2 centimeters in size. It's a bit irregular in shape, means that the borders around it feels not nice and smooth. It is hard in its texture, and there is a bit of pulling on the skin, so what we call tethering of the skin. What happens that within the breast itself, there are certain connective tissues that attach to the skin and the breast tissue, and sometimes some cells and some growths of the lumps can actually pull on these things to pull onto the skin and give you a bit of pulling or tethering to the skin. Also, there is a swelling in the armpit, under the armpit area. It's very small, it's very mobile. Sometimes when we have abnormal lumps, one of the first places that these abnormal cells can go to is the armpit. So this leads me down the pathway of us having a discussion of you requiring a biopsy. However, on the left breast itself, the left breast seems to be very nice and fine. There's no lumps associated there. So the next step really will be for us to consider doing a biopsy. But let me just allow you to ask any questions with the clinical examination, and then I'll go through what the next steps are.
Is this something to worry about?
The fact of the matter is there are some features there in the lump that I'm a bit concerned about, but I don't want you to worry. Let me hold the responsibility of the concerns. And what the next we're going to do is pretty much have a sample of the tissue to see if there's any bad cells.
And how long will the sample take to come back?
We normally will, once we do the clinical examination and we proceed to the biopsy, we get the results within 24 hours.
Okay.
Yeah, and we discuss the findings.
Could it be cancer?
The outcome of any biopsy could be one that is cancerous or non-cancerous. And that's why it's important to do a biopsy, because it's not just an opinion. It's actually something that is tangible, something that actually we can look under the microscope. Another doctor looks at it and tell if there are bad cells there or not. So let me walk you through what a biopsy is.
Okay.
It's a same-day procedure. It's done right in the office here. What I will do first is get you to gang up and get all the necessary equipment, which will be a biopsy needle or a biopsy gun. I want to avoid saying the word gun. It sounds a bit frightening, but it's not as frightening as it sounds. It's just an automated system that allows us to take a sample and gets us the sample that we require to look under the microscope. What I will do first is clean the area. I will give you a tiny, tiny needle stick just to numb the skin and some part of the breast tissue. Make a very, very small incision in the breast, so small that we don't even need to suture it, and it will heal and close on its own within a day or two.
Okay.
And then I put the needle through that aperture, that opening in the breast skin, and I take 1 or 2 samples. Prior to me doing that, though, I will probably fire the gun a couple of times because you will get accustomed to the sound.
Okay.
Generally, I'm not a woman, but generally the pain really is within the skin and probably the subdermal, these overlying tissues in the breast.
Yeah.
So there's not much pain really from
I
a
was
breast
asking
biopsy.
how if it's painful.
Yeah, it's not that painful, to be honest, because we numb the area, we numb the skin.
Okay.
I take about 2 to 3 samples, and I will show you the samples, and I do everything ultrasound guided, so you can have a look while I'm doing the procedure,
Okay.
if you want to have a look.
I don't know if I want to see it, but all right.
So the process itself takes probably like about 5 to 10 minutes,
Okay.
and then the sample is sent in a preservative,
To the lab.
and then I apply a dressing over the area, and then I give you some instructions. The dressing stays on for about 3 to 4 days time. You
And
take
instead of heal for itself.
it heals itself. There's no suture into the skin. You take Panadol, which is generally about 1 gram of Panadol, which is 2 tablets every 8 hours for the next 24 hours. And then you remove the dressing in the shower, and it will be already closed within that 24 to 48 hours. In young patients like yourself, sometimes, I would like to let you know up front, sometimes lumps that could look non-cancerous can still come back as cancer. So we need to prepare ourselves if it goes that way. But I will be here with you, and my team will take good care of you, get you through any of the outcomes. But because this sample itself and the clinical examination is something that is worrisome, if it is that the lump does come back non-cancerous, I think we may still need to consider to remove that area to send for a complete evaluation.
Okay.
And you would say, Doc, why don't you just remove the lump?
Yeah.
Because we should know upfront what we're dealing with. For example, if I go about and I remove the lump without biopsying it and it comes back as cancer, I need to put you back through another procedure. So if I do a biopsy first, then I can know there's 2 outcomes. It's either it's cancerous or non-cancerous.
Non-cancerous, okay.
If it is non-cancerous, we still remove it. But if it's cancerous, I do cancer surgery 1 time. So the standard international guideline for any breast lump is triple assessment, and that's biopsy in a lump. And that's how it should be done internationally.
So
and
I won't jump the gun and ask
Yeah.
if I have cancer. I would probably wait after the biopsy.
But I know
and
you're
see.
concerned, but as I said,
am.
let me be the pessimistic one, and you just continue to pray that everything is going to be awesome.
Okay.
In terms of able to drive and ability to do normal activities after the biopsy, again, it's the same day procedure. You can drive. Generally, patients will bring someone with themselves to be there with them, but it's a normal same day procedure. It's not going to affect your mobility or your activities.
Okay, good.
So we will proceed now to going to do the biopsy. So I will get in this to organize all the necessary equipment. I'll take you into the biopsy room, and we will proceed with the biopsy.
Okay, thanks so much, Doc.
Awesome.
You're making this so much easier.
Yes, definitely.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. And right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
So the biopsy is over, thank God. I must say it was a really smooth transition, and Doc made everything so easy. The way he explained everything to me, so I kind of like know what I was expecting. So for me, the pain, it wasn't as bad as I thought it would have been actually. The pain felt like a little bee sting. And the good news is that being in Medical Associates is that they made everything so easy that I didn't have to go and come back. Everything was done on the same day. And it was like a in and out. And after doing everything and doing this consult and doing the biopsy, as anxious as I feel right now, waiting on the results, I mean, talking to Doc, and he's being the one saying, Shelly, you don't worry. I'll be the one to worry. I'll just pray and have faith and hope for the best. And after the biopsy, I can still live life as normal because I'm going to get my results tomorrow because it's only 24 hours after you do the biopsy. And then you go back to life as normal. When I watched those podcasts and the YouTube with Dr. Oliver and the way he explained, I was like, Medical Associates look like the perfect place. It's a good location. It's easy to find. There's lots of parking. And the transition itself is like so smooth. I felt really comfortable. I didn't even feel like a patient, and I felt like talking to Doc was like having coffee with my friends. So all the women out there, I would always say that, let's not ignore these things. It's a really easy transition, and it's better to know than not to know. So I'm really happy I made that choice. One thing I'll take with me is I'll take Doc's advice, and I will follow through regardless of what the results will be tomorrow. I'll follow through with my screening and make sure that everything is good. And I would always say that, we should always screen as women to make sure that, that there's nothing underlying issues that's coming up.
Lauren, that was an eye-opening consultation because we don't usually see that. It's something that's behind a closed door. And, we're really, really lucky that Shelly Ann was willing to have that conversation with us. Yeah. So tell us now, because I'm sure everyone wants to know, what are the results from the biopsy?
Yeah. But even before we get to the biopsy results, one of the issues I think patients have with actually getting a result is if they should get the results as soon as it becomes available via the phone, or should it be issued by a physician? And also, how would you feel as a woman when someone calls and said the doctor wants to speak to you about your results? Does that lead or triggers a response in you of anxiety?
Are you asking this from my perspective?
Yes, from your perspective.
Okay. All right. As a woman, if I had a biopsy, I would definitely feel a little anxious that the doctor wants to speak to me and that the lab can't just issue my results.
Yeah.
But that's one of the things that we've taken into account at Medical Associates. We have a policy that our lab staff can't issue results to you. You do need to come and see the doctor, and positive, negative, good, bad, indifferent, the doctor will explain the results. Because they could look at a biopsy result and not know what they're reading.
Exactly.
And then you've got Dr. Google, which is going to give you a whole set of information that, one, doesn't make sense and not accurate to that person's care.
I think it's important for patients to know that if they get a call saying that the results is ready and the doctor wants to speak to you, is not to trigger a
Correct.
response.
Yeah, I
think
definitely agree.
Yeah, I think that definitely causes a lot of anxiety.
Yeah.
So it may be good, it may be bad, but also, the doctor himself or herself is going to discuss it with you.
And they will have a plan in place
Yeah.
regardless of what the result is.
Definitely. So this results, actually, we got the results back within 24-hour period. I think we will have an awesome turnaround time to be able to at least get the biopsy report. So there are certain elements in the biopsy report that is required for us to lead into the next pathway of management. The first most important element is to distinguish between cancer and non-cancer.
Of course, yeah.
The next element, if it is deemed to be cancerous, then is the grading. Everyone says when they have a diagnosis of cancer, what's the stage? The grade and the stage on the report is not the same.
Correct.
The grade actually is how the cancer cells look under the microscope. And this is why it's important for a physician to
Correct.
discuss the report.
Yeah.
Because someone will see a report and see the grade and they will say, well, I'm grade 3, I'm stage 3 cancer.
And they think that, that
But
those
actually, it's two
synonyms.
different things. Right? It's actually gives us an idea how the cancer cells are behaving. So we talk about non-cancer cancer, then we talk about grade. And then there are some adverse features on the biopsy report we can see, things like lymphovascular invasion. And basically what it means is if the cancer has its potential to go into those small channels within the breast tissue to spread further.
The blood vessels,
Blood
the lymph
vessel,
nodes,
the
etc.
nerves,
Yeah.
neural invasion, or what have you.
Yeah.
And then lastly, one of the most important aspect of the report is for personalization is the receptor status. I like to use the word antennas, but it's receptors where certain factors in the body binds to these antennas or these receptors and stimulate a response to the tumor. So by knowing these features on the cancer cells, we can know how to treat you. For example, if your cancer has receptors or antennas for estrogen, we know that we can block the estrogen.
And these receptors that we're talking about, particularly for breast cancer, is related to hormones.
Hormones,
And, the female hormone patterns, which can get very confusing very quickly. So I think it's important to break that down and explain it to them.
So on the cancer cells, as in my breast tissue, your breast tissue, there are estrogen receptors and there are progesterone receptors.
Correct, yeah.
Those are the hormones. And we produce hormones in our body, and some of the breast cancers actually likes these hormones to grow.
Yeah.
So if we know that, we can actually block it.
Yes. So basically the hormones feed the cancer, essentially.
Exactly. But not all cancers have these hormones.
Correct, yeah.
So that's why it's important to distinguish which cancers. And that allows us to personalize. So some cancers could be negative for estrogen receptors or hormones and negative for progesterone. So we know that we can't treat it in that modality.
Correct. But some will be positive for estrogen and negative for progesterone, or
Yeah,
the
and that's
other
what
way
makes it
around.
awesome. And that's why each cancer is not the same. Everybody have different permutations, different patterns in their receptors, and obviously different treatments.
Yes.
In the past, everyone was treated in a particular way.
Yeah.
You have breast cancer, remove the breast, and then go for chemo.
Correct.
And that's not the standard now. Each patient may not need to remove the breast. They may be able to preserve the breast. Some patients may need hormone therapy, some may not. Some may need some additional treatments like chemotherapy or targeted therapy, all of which, will be discussed in the meetings when we see you.
Let's go and talk about this lady and what she had.
Yeah. So from her biopsy report, she did come back as breast cancer, unfortunately. But I think the clinical features did significantly suggest that. Her grade was grade 2. So it's somewhat looking like breast tissue still, but it's starting to evolve not to look like breast tissue. She did have some bad features like lymphovascular invasions and perineural invasions, meaning that there is a great propensity for these cancer cells wanting to spread further. And then as we got the report, we sent the testing further. They do further testing, what we call immunohistochemistry, which is how we get the receptors on the same said sample. So it's not something that is done on a separate biopsy. The same biopsy that was done before, we get the further testing on.
Okay. So don't go anywhere. When we come back from break, we'll be discussing Shelley's tumor type and how we personalize her treatment plan.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. And right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
Okay, so let's go back into it. Let's talk about IHC.
Yeah, so her IHC results, interestingly, came back as what we call a triple positive. So
Oh,
it
really?
means the estrogen was positive, the progesterone was positive, another receptor for a growth factor called HER2 was
yeah.
positive, And that now leads us down a pathway of our management.
Well, okay, so there's a lot of different options available here.
Yeah.
So let's start with what this all means for her.
Yeah. So generally, I really like to simplify the additional treatments for breast cancer.
Yeah, yeah.
Yeah. So it can be surgical, which we'll talk about, but then you have endocrine therapy, which is patients who are estrogen and progesterone positive.
That hormone therapy
Yeah.
that people hear
Then
of.
you have chemotherapy,
Yes.
which are patients with locally advanced big tumors, tumors that are involving more than 5 centimeters, involving the lymph nodes, tumors who have pudendrange. Those patients tend to get chemotherapy.
Yes, and you have the two different sectors, right? You have before surgery and after surgery.
Yeah. So you have chemotherapy, endocrine therapy, and then you could have targeted therapy, what we call antibody therapy for HER2 positive, and then you have radiation therapy.
Right.
So those are the general consensus management. But what we were talking about before is treatment before, which is called neoadjuvant.
Correct.
Then you have surgical, and then you have adjuvant therapy. So you can go down two different pathways. You can have treatment before, which we will discuss, and then you could have surgery before and then treatment afterwards.
yeah.
So certain patients, and this is where the individualization, this is where, it really takes a team effort to come up with an ideal plan for a patient. It shouldn't just be you have breast cancer and go for surgery, because some patients could have treatment before, some patients could have surgery first, and it's really benefits in both pathways as
And
well.
that's why we engage the oncologists and the radiotherapists.
Yeah.
And
And that's
all
why
the
we
rest.
have our multidisciplinary management.
Correct.
And that's where we have our medical oncologists on board. We have our radiation oncologists on
Oncologists, yeah.
board. We have the radiologists on board. We have the pathologists, the psychiatrists, the patient, and themselves, what they want to achieve in their treatment, knowing all the various options. And that's what we do.
I really like that you've also included the psychiatrist, because the one thing we have tried to focus on is that holistic approach, because it is an adjustment as a woman trying to, or even as a man actually, to adjust to the fact that you have something that is quite big and has a huge impact on a lot of people around the world.
So we have gotten the biopsy results.
For Shelly-Ann, yes.
For Shelly-Ann. She's confirmed cancer. She's confirmed what we call a triple positive cancer. Now, the most important aspect that most patients ask for is staging.
Right.
Yeah, and this facility is easily available at Medical Associates. At short notice, we can get a CT scan. And it's not just a CT scan, it's a CT scan for your abdomen, your pelvis, and your chest with contrast. So that helps us to see if there's any cancer cells in the chest, in the liver, sometimes in the bone, or if there's any associated ovarian lesions or masses in the pelvis.
These are the most common areas of spread for breast cancer.
For breast cancer, yes. Yeah. So once we have staged, and once we had the receptors, then we have this awesome meeting, what we call the multidisciplinary meeting.
MDT.
And that's where the plan comes out.
Yeah.
Yeah.
And so for this particular case, the plan was what exactly?
Well, even more interesting, I think, another aspect that we sort of missed, again, in the history. And that's why it's so important to link history examination, your biopsy report, your radiological investigation, that she had a strong family history of ovarian cancer.
We touched on that before, yes, the ovarian cancer and how that can impact.
Yeah. And also, so there's an important aspect that we need to focus on is the ovarian cancer, as well as this young lady is under the age of 50.
Yes.
So she definitely needs what we call genetic testing.
Correct.
So, everyone always thinks that I have nobody in my family have breast cancer. How did I get breast cancer? Only 10% of breast cancers are actually linked to familial history or having breast cancer in your family, in simple terms.
Right.
90% is sporadic. Whatever the cause it is, we're not too sure. Most likely it's environmental, food, diet, exercising, cigarette smoking, all these things may be linked to causing breast cancer. So she needs to get genetic testing. Certain patients get genetic testing. Generally, patients who have like a triple negative breast cancer with the estrogen, progesterone, HER2 are negative. Patients who have a family history of ovarian cancer and breast cancer. Patients who have a family history of male breast cancer. Patients who have a family history of pancreatic cancer. Patients who have a family history of metastatic prostate cancer. These are some of the parameters we use to determine who get genetic testing.
Correct.
And genetic testing itself has a significant impact both on medical oncology, surgical, and family management.
Yes, you're right. Totally.
Yeah. So all these things are going to be discussed in the MDT for the management for her. but we can have a general consensus, a general discussion. I don't like to be the one individual to make a decision in someone's lives. So, but I'll just make a bold statement saying what I think she may get after the MDT meeting. Generally, she has a tumor that's involving the breast, which is about 2 centimeters, slightly larger on the ultrasound scan. So, and she has a lymph node involved, and she's triple positive. So she is going to definitely need treatment before, all of which is available at Medical Associates, where we can do treatments such as chemotherapy and targeted therapy for tumors like that.
Right. Perfect. Well, I hope everything goes well for Shelly-Ann, and I look forward to following her progress.
Yeah, she's such an awesome patient.
She is really lovely. Yeah.
Yeah.
So thank you very much for coming today. That's all we have time for.
Sure.
And we hope you come back and check us out the next time. If you're interested in getting information or help from our oncology department, feel free to contact us on 662-2766 extension 4077. Thank you so much for watching. We'll see you next time.